Next, I'll be assessing the anterior chest wall, um, assessing the lungs in the anterior portion. Can you turn this way for me, please? Thank you. First, I'm looking for checking the skin. Again, looking for areas of discoloration to the skin, cyanosis and pallor, checking for moisture, texture, edema, or turgor, which indicates issues with dehydration or circulation. And then finally, checking for any scarring, lesions, nevi, potential problems with her skin. Next, I'm going to check I'm going to palpate the lower portion of the chest wall. And again, we're looking for symmetry. And I'm going to place my hands right there and point my thumbs to the midline of the patient's chest. And I'm looking for symmetry when she takes a deep breath in and out. And those thumbs, my thumbs do expand together in symmetry, which indicates that her chest is symmetrical. Next, I'm gonna palpate for fremenis. And to do that, I'm gonna be using my ulnar hands, the ulnar part of my hands, excuse me. And I just need the patient to say 99.
99.
And I did get equal fremenis to both of my hands, which indicates that there is no symptoms of consolidation going anywhere, no increased fremenis or decreased fremenis. And next, I'm gonna auscultate her lungs in the front. Can I just get you that you can be on camera? Thank you. Take a deep breath, please. This clear lung sounds bilaterally to the anterior portion of her lungs. Next, I'm gonna assess her cardiac, her heart. I'm gonna be auscultating the aorta area, then the pulmonary area, Erb's point, and then the tricuspid area, and then the mitral area. It's Erb's point right here. The tricuspid area. Then your mitral area. I did not hear any bruits. Everything appeared to within normal limits. Next, I'm gonna palpate the PMI, and that's gonna be midline to straight down to the 5th intercostal point. Okay, and then next I'm going to listen to her apical pulse. And you would do that for 60 seconds, listen to the apical pulse. Next, I'm gonna, let's see, assess apical pulse. Next, we're gonna move on to I'm gonna assess the patient for, give me a second, I'm drawing a blank here. I'm gonna assess, I'm gonna have the patient lay down in the supine position. Please excuse me. If you could lay down, I'm gonna just lay back right here. Yep. And I'm gonna assess the patient for any heaves or lifts. And again, this would determine whether the patient is possibly has enlarged valves to her heart. And everything looks within normal limits. Next, I'm going to palpate the same areas that I auscultated earlier. And that is the aorta area. Now we're moving over to the pulmonary area. And then Erb's point. And then I'm going to move over to tricuspid area. And then we'll do the mitral area. Next, I'm going to auscultate these areas while she's in the supine position. Let's say aorta area, pulmonic area, Erb's point, tricuspid area, and finally mitral valve area, or mitral area. Next, I'm going to have the patient, I'm going to check the patient for, excuse me, I'm going to check the patient for aortic regurgitation, and that's going to have the patient sit up, and she's going to have to bend over, and I'm going to assess that. I'm going to assess the third and fourth intercostal space there, right near the Erb's point. And I'm going to have the patient take a deep breath. And that was a negative on that. There was no aortic regurgitation. Next, I'm going to have the patient lay down on her left side over here. If you could lay down on your left side. And I'm going to be checking for mitral stenosis. And I'm going to place my stethoscope at the apex of the heart. And that's mid-clavicular and the fifth intercostal space. And that's a negative for mitral stenosis. And then finally, I'm going to assess the patient for JV what? P. jugular venous pulsation. And I need her, well, we're gonna imagine that we have a reclining hospital bed here, and I'm gonna have the bed elevated at 30 degrees. And what I'm assessing for is I'm assessing for cardiac, carotid or jugular distension, which is negative. And this concludes the assessment. Do you have any questions?
No.
All right, well, thank you very much.
Thank you.